Okay, wait. Sorry.
It's okay. I can like cut it. Wait, what were you gonna say?
No, it's fine.
Okay.
Hello, my name is Shay Sweat, and this is my group. We have Grace, Han, and Madeline, and we did our project on ICU delirium. And it was really interesting, and we learned a lot of things, so we're excited to share about it.
So a little bit of background on ICU delirium. ICU delirium is classified as a disturbance in consciousness and cognition that often develops suddenly in critically ill patients that are staying in the ICU. So in Sharon Hickens' article, it characterizes ICU delirium as an acute onset of cerebral dysfunction associated with fluctuating mental status, inattention, and either disorganized thinking or an altered level of consciousness. So due to the lack of nurses' knowledge, many people suffer and develop ICU delirium. And a study done by Sarah Elliott showed that 44% of respondents, which was 33 participants, were not educated on ICU delirium. Even though this is less than half, this is a large amount of nurses that are uneducated on a common ICU complication. The statistics on this article also show that 170 out of 681, which was 25% of the patients in the study, were routinely screened for ICU delirium. The screening tools that should be used for detecting ICU delirium is the SAS, the Sedation Agitation Scale, and the RASS, Richmond Agitation Sedation Scale. The clinical issue is that nurses are not being educated enough or at all on the organizational level or the unit level on ICU delirium, and patients are the ones that end up suffering from this clinical issue. Why is this significant? Its long-term neurological effects often are very hard for patients, and the longer hospital stays for ICU delirium cost the hospitals more money. And then when we applied this theory, we chose the Jean Watson. She's best known for her theory on human caring. Her theory is about caring for others while caring for yourself as a nurse. She has 10 curative factors, one being deepen. This one was really cool because it's scientific problem-solving methods for caring decision-making, which directly relates to our study, our research. This connects because our PICO question is implementing education to nurses to prevent or decrease the number of patients that develop ICU delirium. And the quote from Stitzman, caring means different things to different nurses, depending on amount of professional experience, level of education of the nurses involved, where and how the concept is applied, personal values, and professional focus. This quote shows that the level of education is related to the concept of caring. In order to provide the best care, all the nurses need to be well educated. And then to tie everything together, nurses need to care for themselves. And through the expansion of knowledge on ICU and delirium in order to care for the patients, through the prevention and decreasing the numbers of patients developing delirium in the ICU is in itself self-care, which translates to quality patient care.
So this was our PICO final statement. During our search process, some of the keywords that we used were education, ICU delirium, assessment tools, and prevention. And these all were, we just used these to find the articles that we used to formulate our PICO question. The database that we used was CNOL. And then our final statement was, does specific preventative education to nurses on ICU delirium decrease the prevalence or the number of patients developing delirium during a stay longer than 7 days in the ICU compared to the current standard? And then some of our implementation strategies. Obviously, the primary goal is to increase nurses' knowledge on ICU delirium, specifically on prevention and treatment strategies. And then this in turn reduces the number of days that patients have to stay in the ICU. Some of the articles that we found talked about different interventions that can be used in nursing education. And some of them were the voice reorientation method, simulations, and then various assessment tools, one of them being the CAM ICU tool. So the voice reorientation method, basically nurses can use family members' voices to reorient the patient to reality. If needed, they can play recordings or the family can be physically present. There's also simulations. They're similar to the simulations at Belmont. Nurses would have the opportunity to practice communication, various assessment tools, and other treatment protocols before using them on actual patients. So this could prevent errors and just increase their overall knowledge on how to handle ICU delirium. And then we could also educate nurses on assessment tools. Obviously, it's essential that nurses understand how and why these tools are used. One that we focused on specifically was the CAM ICU assessment. And this allows the nurse to recognize symptoms and then, based on a patient's symptoms, put in place different protocols depending on their severity. And obviously, educating nurses on all of these different treatments is important. And then this applies to practice, like Madeline mentioned. Jean Watson's theory of human caring is all about caring deeply for our patients. And if we're caring deeply for our patients, we need to be taking proactive steps to be educated on ICU delirium. This is a way that we can show our patients we care for them and desire to prevent any additional complications during their stay. And then our overall outcome for this PICO question was to increase the number of nurses educated on ICU delirium, which in turn would decrease the overall incidence rate of ICU delirium. And so the indicator that we can use to measure the success of this outcome is the ICU assessment tools and measure like how often they're being used. The one that we focused on, like I said, was the CAM ICU, or the confusion assessment method. And then we could look at the scores. So the scores should decrease as education for nurses increases.
So when implementing new evidence-based practice, things such as the different screening tools and such, it can be a challenge. And some of those barriers are lack of awareness, forgetfulness. Sometimes, like when nurses and healthcare workers have gotten into a routine, it's easy to forget about new evidence-based practices. It can be very inconvenient for them. Sometimes evidence-based practice is more time-consuming, and nurses are very busy, so that can often prohibit them from doing best practice. The behaviors on the floor are heavily influenced by the workflow. So if you're on a very busy floor, again, you may not do the best practices. It can be out of their comfort zone. It's different, it's new, it's not what they were taught in school, and so that can definitely be challenging. And a lot of times nurses and healthcare workers get into a consistent routine, and changing that up can be very difficult. So some strategies that can help with change. Coder's change model is a great one, and this is just based on 4 steps. And so the first step would just be creating a sense of urgency, and that just means letting the healthcare workers know like how important it is for this to be changed, and showing them like the bad outcomes that can happen if best practices aren't being used. The second step is form a guiding coalition. You want to get a group of people together that can support this and make a difference. Create the vision, make it practical, so that the nurses and other healthcare workers can easily implement it into their day-to-day practice, and then communicate the vision with all the healthcare workers so they can see what the goal is moving forward. And so dissemination strategies, this is also super important because this is actually applying the new evidence-based practices. And so dissemination strategies aim to spread knowledge and the associated evidence-based interventions on a wide scale within or across geographic locations, practice settings, or social networks of end users such as patients and healthcare providers. So some great ways to inform the healthcare team of change can be done through seminars, team meetings, national journals, and then just distributing educational materials to let them know how important these things are. And in the book, it talked about the tag, flag, nag approach. And this was a really unique way to get evidence-based practice implemented into the regular workflow. And so tagging involves identifying and recognizing the staff that adopt the practice change and just encouraging them and making them as like a model in a sense so that other workers that may not be doing these evidence-based practices will tag along. Flagging involves identifying the less compliant staff and discussing ways that we can implement this into their practice, because again, a lot of times the reason that evidence-based practices aren't used is because it's time consuming, it's not convenient. So we want to find ways that we can make it work. And then nagging is the last step, and that involves dealing with consistent non-compliant staff. And this often involves getting higher leaders to address the behavior. So yeah, those are just some ways that can really help.
One of the takeaway from this EBP project that we will carry forward into our future nursing practice is that EBP is crucial in the field of healthcare. There are major different steps to take in order to achieve the effective evidence-based practice, and we have to carry out each step thoughtfully in order to ensure that the intervention will have the desired effect on the patient outcomes. And evidence-based practice offers nurses a technique on using scientifically proven and critically appraised evidence to provide high quality of care to a variety of patient populations. And this allows nurses to have a confidence in their care and enhances the positive patient outcomes. And one challenging thing about this group project is that it's the format of online learning, and since we don't meet in person, it was a bit difficult for, especially for the group project. And with that being said, one of the things that went well with our group is our communication, because we were always able to communicate with each other about our project. All of us were aware and clear with our task, which allowed us to effectively complete our project. And necessary skills of a nurse to effectively collaborate with other people on a project. One of them is self-awareness, because knowing our own strengths and weaknesses is crucial. When we recognize our own strengths and weaknesses, we will be able to maximize our contribution in a team project. And additionally, self-awareness allows us to recognize and free us from our own biases and assumptions. And second skill is that open-mindedness. Open-mindedness is one of the most important skills of nurse to effectively collaborate with others on a project. In a team, there are different people with different perspectives coming from different areas of expertise. With that being said, it is inevitable that there will be many different ideas that we might be unfamiliar with or disagree with. So being open-minded will allow the team to gain new insight and even develop more effective techniques. And additionally, open-mindedness can help all of us grow as a person by learning new things. And two opportunities for growth are improved communication. It is obvious that nursing requires teamwork, and we believe that we can always improve our communication skills by practicing active listening, which is all about engaging and being present with the speakers by providing affirmative replies and asking questions. Effective communication will allow us to be more productive and prevent consequences that come from miscommunication. And another area is improved adaptability. Another skills that we could improve is our adaptability. Being adaptable to changes is crucial in nursing because it allows us to assist the team as needed and overcome unexpected situations. And we could all become more adaptable by always looking to learn new skills from our fellow nurses and by always paying attention to the situation around us in order to be prepared to change as needed. Next slide. After completing this course and EBP project proposal, we don't think our perception of nurses' role in patient care have changed. We have always believed that nursing is a lifelong learning career. It is the nurse's responsibility to be able to always adapt to new ways of effectively delivering care in order to provide the best quality of care to the patients. EBP allows the nurses to be able to always provide care that has been researched and proven to be most effective to the patient in order to improve the patient outcomes. That's all. Thank you. Here's our references.